At the Dallas Heart Center, there's a team of people that love children, they love taking care of children, and it's a very, very user-friendly environment. And parents and their children like to come there.
We have a wonderful staff that deeply care about these children and wants the best for these children and best outcome for all these children.
A lot of people are involved in achieving the results that we have here. I got to emphasize that. It's very much a team sport.
He was tiny, a little 5-year-old who was suffering from such a lack of oxygen that his skin was blue on everywhere. His lips were blue, his eyes, the whites of his eyes weren't white, they were gray.
His fingernail beds were dark purple, and his nails are the so-called clubbing, where the nail is not straight, but it's because of chronic cyanosis and some of the physiologic manifestations of it, the nail bed gets turned downward, sort of turned a little bit, and it becomes quite puffy. Over time, his heart would fail, as well as all of his body organ systems, and he would have not survived.
When Ryan and I first walked into the Dallas Heart Center, we immediately felt at peace and like we were in the right hands. Like we knew that if anyone could save Ryan, this was the place, this was where we had to be.
When I was in Jamaica, I basically couldn't do anything, but when I came here and had my first surgery, I was able to run around the house and outside and play with my brother, so I felt better.
He is such an exquisite young man. He is a beautiful young man. He has made such beautiful choices, and I think he realizes that he has been given a gift that most people don't get, and if he had stayed in Jamaica for 6 more days, he wouldn't be here.
These kids, they got dealt a bad card. They weren't smoking, drinking, and they didn't do any of those things to themselves. They just got dealt a bad card. So we're here to give them a second shot at life.
You want to see a young man running around, growing, playing soccer, and knowing that you help them to do that, and that's what keeps you going.
They get to graduation, they get to marriage, they get to children, they have a job, they're functional. Without it, they don't survive. For me, that's the cornerstone. That's what gets us all up in the morning to work and do this specialty. And believe me when I tell you, I mean this very sincerely, it's a privilege to do it. I thank God every day that I can get up every morning and do it.
Cardinal Glennon saved my life, so if I was there in Jamaica, I would be dead right now because the equipments they have there, it couldn't help me at all, so I think God really helped me so I could get a family here and come to this hospital and get better.
The Dallas Heart Center is a gift, not only to the people of St. Louis who are so close to it, and we are so blessed to have our children born here and be this close, but it is a gift really to the world because we have had children come in from so many different countries who have been saved by the Dallas Heart Center.